Good morning again at 9:24. In this morning's What's Going Around segment, May is Mental Health Awareness Month, and Pix 11 wants to highlight the resources available for anyone seeking a diagnosis or treatment. Dr. Abdul Hussain Vali is an urgent care provider with Essen Health, and he joins us this morning to share his expertise. Dr. Vali, we want to thank you for being here. Our first question, as an urgent care physician, you are on the front lines of healthcare. Tell us, are you seeing a surge in patients with mental health issues seeking treatment, and who are those patients? Men, women, kids?
Good morning. Thank you. So yes, we are absolutely seeing a sustained rise in patients with mental health concerns. What began as a surge during the pandemic has not returned to baseline. In regards to your second question, all groups are represented, but there are three groups I would like to highlight: the adults, the young adults age 18 to 24, and adolescents, especially girls age 12 to 17.
And what are the most common diagnoses that you're seeing?
Yes, so for adolescents, a lot of them are presenting with anxiety, depression, self-harm behaviors. The young adults are struggling with substance use disorders, acute stress reactions, panic attacks, and then adults are overwhelmed by their chronic mental health conditions, which are undiagnosed or untreated.
Well, how do you evaluate whether or not a patient is suffering from a mental health issue? Are there specific tests?
So that's a great question, because not everybody walks in saying I'm depressed or anxious. They might have chest pain, palpitations, headache, difficulty sleeping, and turns out they have underlying mental health conditions. So we don't have a specific test. There's no lab or imaging test, but we use our clinical judgment, our assessment, that is history, physical exam, and we have validated screening tools like PHQ-9 GAT7 to identify symptoms and formulate diagnosis.
At what point would you say medication is necessary?
So another great question, because medications are necessary when your symptoms are moderate to severe based on these validated screening tools, or if your symptoms are severe enough that it hampers your daily function, that is activities of daily living, including social life, or your symptoms are severe enough that you are at a safety risk to yourself or others.
Dr. Abdul Hussain Vali, thank you so much for stopping by. Dan and Hazel, I'm going to send things back over to you.